Good afternoon, everyone, or morning as it may be, and thank you for joining us today. We're going to give folks just another couple minutes to get settled into the meeting before we get started here. While people are still joining the meeting, I'll go over a couple logistics. If you have any questions during the presentation, please drop them into the chat or raise your hand using the button at the bottom of the screen. We'll make sure to leave time for questions at the end, and we will also share the presentation and recording after the meeting. Just going to give folks another couple seconds. Are we good, Brittany? Okay. Thank you for joining us today and learning more about CURIS and our remote clinical services team. My name is Haley Taylor, and I'm a consultant with CURIS. I've been in consulting for about 25 years in hospital systems, community clinics, and corporations. My work has focused on process improvement, communication, business transformation, and data-driven decision-making. Joining me today is our Director of Client Engagement, Brittany Marcus, and presenting today is our Director of Solutions, Evelyn Atkins.
Thanks, Haley, for the introduction. I'm Evelyn Atkins. As Haley said, I'm the Director of Solutions. I'm a nurse by trade. I've been a nurse for about 13 years now. Most of my career has been focused on the FQHC space, working as just a nurse in direct patient care, and then transitioning into risk manager and quality improvement director. And then I came to CURIS and started working with our remote clinical staff. So now I'm managing our that side of our company and our remote staffing to help support folks like you all.
Just a couple seconds about CURIS. We were originally founded as a population health firm. Over time, we've built out our services to address the gaps that our FQHC clients were needing, such as operational consulting, remote clinical services, and AI technologies. Currently, we partner with FQHCs, PCAs, and HCCNs in more than 40 states. Today, we want to walk you through a recent client experience with our remote clinical services team. We'll talk about the challenges our client faced, what we learned as we integrated with their team, and the results that we have seen so far. Then we will hear from their CMO and take questions at the end. Now I'm going to turn it over to Evelyn, who will set the stage about the problems the health center was facing and how our team helped.
Thank you, Haley. Yes, as Haley was saying, we have worked with a health center more recently over the past year or so, couple years. And they have 8 clinics, and they're servicing more than 30,000 patients across their whole community. Like many health centers today, such as yourselves, we've all experienced the staffing shortages. Turnover is super high, especially after COVID. It's really hard to keep clinical staff within the health center space, especially trying to compete with the hospitals and the incentive pays. That's just not something that they are able to do just because hospitals have more dollars to be able to throw out at their staff. So turnover super high. Teams remained very stretched and thin, feeling like everything was on their shoulders and everything was on fire. So we see these situations quite frequently. Provider care teams are spending a ton of time on things that aren't direct patient care. They don't have enough nursing staff to help them. And just being able to keep things moving and running smoothly. So the list was long for this health center. They had their own internal urgent cares within the 8 clinics. They had 2 separate express cares. Their medication refills were piling up. Referral coordination was falling really behind. And then something as simple as like a patient portal message, the patient's calling in or sending a message in and wanting to know, what their x-ray results were, their MRI results. They were just stacking and piling up, and everybody felt like they were behind every day. Same thing with the triage calls. They were coming in faster than internal staff could respond to those. So over time, it just started to compile and made a large problem. Patients would call in with a symptom and then play phone tag with their internal staff. So sometimes they wouldn't get a response for days. And then the providers felt like they were behind. So staff were trying to keep that tidal wave from constantly coming at them and fighting off the risk management piece. The risk management team was really feeling over inundated with patient complaints. They knew they had the clinical capacity schedule wise, but not really when you incorporate those administrative tasks. So providers were overwhelmed, and you don't want your providers leaving. You don't want your nursing staff, your MAs, your front desk felt like the patients that were coming in and complaining was really causing a large stressful situation. So the leadership team decided, okay, we really have to figure something out. We need to come up with a solution to be able to, handle these issues same day and talk with the patients same day. So we can keep them out of the hospitals and, keep them in our clinic and not going to see other people. So since the patients weren't able to just even get into the health system quick enough, we began working with this health center and not just giving them solutions right away. Instead, we did a gap analysis. That's something that we typically come in with the health centers to do, just to see and understand what their true day looks like. What are their pressure points? And they weren't alone. Even when I worked in the health center space myself, this is something we saw all the time. So we spent time looking over their workflows, the call volumes, any of the backlog that they had from patient medication refills, portal messages, any of the x-rays, labs, MRIs, any of that stuff that the patient is just waiting on, and seeing what we could do to make their day better. So it became apparent very quickly that the most critical point in the entire process was the live patient on the phone. So when the patient had a medical concern and they couldn't reach somebody who could help them in real time, a few things would happen. They would call back repeatedly, which makes that log even longer. So, you may have started with 20 messages and now everybody's calling back the next day and the next day after that, and you're still trying to play that catch up. You're still trying to put those fires out continuously. They weren't able to get that incoming patient call, assess the symptoms, and give the patient the appropriate level of care. So that's where we dedicated a remote triage staff and remote nursing triage staff to help alleviate those pain points and give those patients the appropriate level of care. And if I'm calling in with an earache, I can talk with a nurse and get steps on what to do instead of just going straight to the ER and over inundating the ERs. That's why the waits are so long, because people go in for something as simple as a cold or an earache, or, they have an infant and they're not sure what to do about a fever. So they rush to the emergency room. So we want to keep them in the health center. We're their family medical home. So we want to keep them there. Once we integrated the remote triage staff, we saw that huge bottleneck remove almost instantaneously. The patients weren't waiting days any longer for a response from someone. They were able to talk with a nurse right away or within 30 minutes, which was astronomical. Inboxes weren't feeling over inundated. The providers weren't coming in and saying, hey, my MAs haven't called these patients yet. I know they're direct patient facing just like I am. They just don't have the time to do that. And the front desk staff, they no longer felt like patients were coming in and yelling at them all the time, and them also trying to give clinical advice that they're not really trained to do. You don't want that. That ends up becoming another type of risk issue. So over time, we saw what I think is so important, and that's restoring trust back to your patients. They were able to get responsiveness and get better access to care. And keep them, instead of going into that emergency room, like I said, and just focusing on, seeing their primary care doctor and feeling like they're a part of that medical home again. So to me, I think that was one of the most successful pieces of this, is that trust piece with their patients, especially in the health center space. Everybody knows each other. They may all live in that same small community. They stand at the bus stops together. They work together. Their kids go to school together. Their kids play together. All those things that you guys all are familiar with within the small communities, even the larger communities. Everyone's like a family or a relative or a friend of someone. So trust is very, very important in any sort of relationship. With your providers, your nurses. So, what I would say, instead of constantly trying to catch up with that administrative work, since we were able to alleviate the burden, leadership also began to see the complaints decrease and improve communication drastically. So I think those, just before you hear from Dr. Hatuk, some of the positives of being able to handle 30 minutes or less with a triage call or any sort of call, and then calling same day if I send a message to my provider. Like, I just want to know if I'm taking my metformin properly, or am I supposed to eat when I take it? Or have you sent my prescription over to the pharmacy, and not waiting a whole week to 2 weeks just to get a simple, chronic care management medication for diabetes, hypertension, something like that. So I think those are some of our big wins with this. And then being just an extension. We never want to replace the staff. We want to be like their extra arms, ears, and eyes. So that's what's great about the model, and being able to keep, as it says on your screen there, over 300 patients from going to the ER and keeping them internally, and going to the express care and seeing their provider instead. So, Haley, I'll turn it over to you.
Thanks, Evelyn. As Evelyn mentioned, our team is now fully onboarded with the center, and we have positive results to share. So I'm going to show you their current dashboard, which is just 3 months of data so far this year. It's Q1 report. The center is a medium to large health center with 56 providers and more than 30,000 patients. The chart on the right highlights the year-to-date data that we are seeing, and we fully expect these results to grow as we continue to integrate our team and support their workflows. We have fulfilled more than 16,000 clinical tasks in Q1. So just as lab results, medication changes, x-ray results, inbox messages, appointment follow-ups. We've completed more than 8,100 med refills within 24 hours. And these would previously take several days, as Evelyn mentioned, to complete, and were frustrating both the providers and the patients. Patients would often call in duplicate requests for the same results because of long turnaround time. So that just added more confusion, more burden, and noise to the system. In the first quarter alone, the approximate hours that we have removed from providers and nurses' plates is more than 1,500. And this is time that is really given back to the providers and nurses as reduced burden and burnout, as well as increasing the care access to the patients because it frees up more scheduled time for more appointments. Financially, this is anticipated to save approximately $60,000 in the first quarter. These are dollars that are no longer being paid to the care team to fulfill these tasks. And obviously, there are extra revenues being generated with those hours as well in the form of direct patient care, like Evelyn was saying, keeping people out of the ED and keeping them in express care. We're conservatively estimating that to be about 150,000 in Q1, plus any revenues that are retained from the extra express care and ED, keeping them in-house. Some of the additional improvements that we've not yet quantified are the improvements to patient satisfaction in the form of response time, improvement to patient quality and access, increased staff satisfaction, and cost avoidance in the form of recruitment and other HR costs. So we're looking for ways to measure these improvements in the near future. We're now going to share a recent conversation with Dr. Hatuk, the CMO of East Valley Community Health Center, who reached out to our team to help with this challenge in his center.
All right. Well, hi, Dr. Hatuk. Thank you for joining us today and agreeing to share your experience with others. Um, we're going to kick the call off. We want you to introduce yourself a little bit and the role at the clinic that you're with.
Sure. My name is Dr. Chinam Hatuk. I am the Chief Medical Officer here at East Valley Community Health Center. I joined the practice after residency, where I moonlighted multiple FQHCs during my final year. I decided to go with East Valley. That was back in 2013. I've been the Chief Medical Officer since 2014 till now. And I oversee clinical quality, provider operations, and any partnerships that affect how care is delivered to our patients, including our relationship with you guys, CURIS. So that's my role, and I'm happy to do it.
Yes, thank you. You've been there quite some time now.
Yeah, yeah.
Very,
It's been a very fruitful position, very satisfying in terms of career. Love the patient population. I grew up about 5 miles away from our Pomona site, so
okay.
I grew up in that patient population. So it's very near and dear to my heart.
Yeah. It's very rewarding work. It can be taxing at time, but it's so rewarding
Yes.
to be able to give back to the community and those who really need it and those, the underserved, right? That's why we're all
Yeah.
here.
Yeah. It's
So
very, very fulfilling. Very fulfilling.
it is. It is.
Hi,
Okay.
Dr. Atik. It's good to see you again. Can you tell us a little bit about some of the challenges your clinic was facing from a patient call, triage, clinical inbox management before you partnered with us?
Oh, wow. So, especially post pandemic or yeah, pandemic and post pandemic, we were having issues with our nursing staff. Of course, we know that a lot of the nursing staff during uh, the pandemic was very wanted, and it reflected in hospital salaries and recruitment and all that stuff. So a lot of the FQHCs and ambulatory care clinic sites lost their RNs because of that, and it's been a struggle to get RNs back into the clinics post pandemic. That being said, Uh, a lot of those items that an RN could take care of ended up on the care team's plate, which really hindered their day-to-day operations and clinical workflows. Having to stop to triage a patient or manage a medication inbox or just answering questions from patients really took up a lot of time, and therefore it affected the efficiency and quality of care that was being delivered in the clinic walls. So we were really struggling to fill that void, and um, thankfully we were partnering up with Curis for other projects, and our consultant suggested that we also do nursing. So that's how we were introduced to Curis, and it's been a great relationship.
Fantastic.
Yeah, one that we truly value. You've been such a pleasure to work with. With that being said, what would you say the implementation process has been like, implementing our remote triage team to start helping support the clinic? Have we been easy to integrate with?
Oh, yeah, I would say it's been fairly easy compared to other integrations that we've had in the past. I think the thing that set us up for success was already having a telehealth system, already having done remote work, and having remote access to our EHR was vital in the implementation process. So it made it very I wouldn't say seamless or without its problems, but easier to implement than most other projects or initiatives that we had. Um, that being said, it's also a testament to your team and how involved you are in working with me and our IT and our operations department to make sure that not only were the connections set, but things like our policies were up to date to make sure that uh, the nurses were working within their scope and also within the policies and procedures of East Valley. So, your team has been great in the implementation process.
Oh,
Yeah. Well,
fantastic. It's good to hear. How have things changed in your world day to day as a provider as a result of our triage nursing team?
Greatly. So one of the major things is the medication refills have been uh, not only been taken care of, but also just information from the patient or from the pharmacy that is critical to the care of the patient has been relayed back to the providers in a very efficient way to make sure that medications are updated, SIGs are updated, uh, appropriate changes of medications are conveyed across both sides so everyone understands what's going on. That's been wonderful and taken a big weight off of the provider's plate. Um, Things like triage has been very helpful as well. Um, Having a phone line where the nurses can be contacted for any kind of patient questions or concerns, and having them triage to either come in to be seen or go to the ER, or having their answers right then and there have really helped the providers focus on the inpatient clinical work or in clinic patient work, um, instead of having to field calls and take messages and things like that. So that's been a great help. Also clearing out our inboxes, just going through the inboxes that have been backed up and PAQs that have been backed up to take a clinical lens to it and making sure that they are being addressed, and identifying a lot of the junk as well. That's helped our IT move forward in identifying what things are necessary and what things aren't, because we get a lot of duplicates, we get a lot of messages that are erroneous or just kind of junk, like we can't do anything with. Right? Like, why are we getting these messages from outside pharmacy with no suggestions? It's just denials or things that just clog up our inbox that
Right.
aren't fixable. Right?
Extra noise that you don't need. Yeah.
Exactly.
yeah, the extra noises, we can eliminate that, we'll have a better day for sure.
Yeah, yeah. It's just not just eliminating it, but identifying them so we can take a proactive step in
Yeah.
preventing them. That's been a big help.
Yeah. How would you say, from your perspective, Dr. Hatuk, patient satisfaction has improved overall?
Oh, again, going back to just the medication refill issue, um, patient satisfaction has gone up because medications are being refilled or renewed on time, and any kind of issues with the pharmacy, um, the nursing staff can help facilitate that fix, so the patient doesn't have to go back and forth. So
Mhm.
definitely patient satisfaction has gone up. Um, Wait times on the nurse call line also. So patients aren't left in limbo, and just wondering when is my answer or when is my question going to be answered, or when is
Mhm.
someone going to call me back. Uh, that has definitely been an improvement because of the nursing care team.
That's
Mm,
great. That's
that's
great.
great to hear. How do you feel that our team has integrated or coordinated with your staff? I mean, how do you feel that because we're obviously the remote triage team, how do you feel that is coordinated?
there were growing pains, for sure in the beginning. A lot of providers not understanding the process or not understanding why these medications are getting kicked back or pushed back. But after extensive training and education and making sure that everyone understands, like, there are policies and procedures and scopes of practice that everyone needs to follow,
Mhm.
especially a remote nursing triage team, because they are remote, so there should be a hard set of rules and guidelines that they need to stay within. And of course, those things within their scope of practice can be modified, right? So having that open door policy with your team has been great.
Mhm.
Evelyn's come to me about policies and questions, texted me on uh, directly to my line. I don't mind that stuff. I let the team know that it's open, just to help decrease delay of care. So your team has been really open and perceptive of that, and it's been really helpful.
That's great to hear. Thank you.
Yeah, it truly has been a pleasure. We appreciate your openness to take feedback and work through workflows and share things that have worked with other practices as well, and think about or adopting those.
Oh yeah,
So, with that being said, would you recommend this model to other clinics that are facing the same issues?
yeah, absolutely not. We're gonna keep you guys to ourselves. We're gonna
We're glad to
we're
hear
gonna
that.
yeah, we're gonna gatekeep this. No, I highly recommend it to any other clinic that is facing issues with their nursing staff, or just issues with ancillary care items for primary care. There's a lot of coordination that's involved in primary care. There's a lot of information coordination that needs to happen, from referrals to pharmacy to specialty care. There's a lot of stuff that needs to be um, not only reviewed, but conveyed to the right members of the care team and the patient themselves. So having a effective and efficient nursing team is vital. It's medicine's a team sport, especially primary care, and without um, a nurse working to the top of their license, it's pretty difficult.
Hmm. Yeah, we've seen that in so many different scenarios.
Absolutely.
Um,
I
yeah.
think I think as you've touched on it, I mean, communication and flexibility. I mean, the ability to continue move forward in a quick sort of way is critical. Uh,
Yeah.
I know you've told us so many wonderful things, and I appreciate your candor. Um, if you had to pin it on one thing, I mean, what is the most valuable impact that you have seen from your perspective that we have had on your patients or your providers?
I think the decrease in the delay of care, like making sure that patients are getting their medications on time, and taking that load off the providers. So care becomes more efficient. It's not this kind of disjointed and herky jerky kind of care, where you could be as a provider making a care plan, but then getting hung up by things like prior auths, or medication errors, or refills and things like that. It really helps facilitate a forward progression of the care plan.
Awesome. Thank you.
Yeah.
Yeah, and I think Dr. Hatuk, we've just scratched the surface. There's so many things that we can add to help support your teams within the clinic and the patients. So very excited to see where our time goes and what else we can implement. So I want to say thank you again, Dr. Hatuk, for joining us to discuss our remote triage services. We appreciate you taking time out of your day to share your experience, as you being a very, very busy doctor. So we appreciate that and look forward to working with you
Thank you. It was
continuously.
great talking with you.
Oh yeah, same thing on this side of the camera. Um, yeah, highly appreciative and grateful and thankful for all that you guys do. Patient care has improved. Quality of life for the providers have improved, and for me personally as a CMO, our profession as a CMO, a lot of those burdensome calls have been relieved too. those after hour medication refills that are urgent? Are those um, critical labs, things like that? Like I know these things are important, so if they come to me, I don't mind. But just having a nursing team that could field those
Mhm.
before they get to me has been really helpful, not just in the front parts of the clinical workflows, but on the back parts. Like we don't want it to get to the the end of the hierarchy. That's when
Mhm.
things are too late. You don't want to go through calling 10 other people before you have to call the CMO, right? That by that time it's too critical, and patients' health and their well-being is in danger. So I appreciate that peace of mind that the Curious nurses have given, not just me, but our East Valley providers as well.
Thank you
Awesome.
so much, Dr. Hatuk. Again, it's been a pleasure. Thank you so much.
Yes.
Thank you.
Well, thank you all. That was really the heart of what we wanted to share with you today. We'd like to thank Dr. Hatuk, obviously, for bringing us into East Valley, but also being willing to share his experience with us. Now, we would like to take questions from either from the chat or the raised hands.
All
I can
right. Well,
also
hi, Dr. Hatuk. Thank you.
place our contact information in the chat for any future questions you may have, or if you would even like to schedule a discovery call with our team, we would be happy to meet with you. Does anybody have any questions that they would like to talk about? I did answer one in the chat while the video was going on. It was our team that provided the remote triage nursing services, and it really just varies by level of engagement that you need, and we're happy to work with each health center. Evelyn, Brittany, anything that we missed that you want to add?
No, I would just say this model can be adopted in many other ways, whether it be a value-based care model, gaps in care, quality metrics, things like that. That's there. The possibilities are truly endless with being able to integrate the remote staff and being your extra set of arms like I was discussing earlier. So that's something that we've integrated. We've also integrated in practices some of our AI technology. So this model can be adopted with strictly staff, and it can be staff and AI combined. Something we've turned on that I don't think this captures is recently in the past several months is turning on AI for medication refills to capture it and put it into a task for the nurse, so it keeps the patient from having to wait for a call back. So we put in strict guardrails and create the task so the medication is sent, and then the AI lets the patient know, it can update the pharmacy in there if they want to change it, verify dosage, things like that, just to take a little bit of the load off of any of the either internal or remote staff. So that's been a huge win, I think, over the past several months, taking at least 50 to 60 of those types of phone calls a day and turning it into just a task that you can read, take care of, and shoot the med refill over. Same thing with call center. That's something that we've implemented within East Valley, is having AI take the inbound calls. It's making the outbound confirmation calls, but also doing the inbound call and figuring out where that patient actually needs to go. We were able to remove, within incorporating that and the remote nurses, remove a whole team that was, for lack of a better term, like glorified receptionists after they already went through the call tree. So the patient's repeating themselves multiple times before they actually get to have a conversation with a person, and pressing this button and trying to hit 0 10 million times just to get an answer. So instead of doing that, we've trained the AI and set up those guardrails to be able to ask the clinical questions and do like a warm handoff to the nurse so they know, oh, I have Evelyn Adkins on the phone and she's experiencing right ear pain. She's tried Tylenol, ibuprofen, it's still not working. Something along those lines to do that warm handoff so that way the nurse can already pull up the chart, know the patient, go through their meds and say, okay, I'll take the call, get them on, get them on the line and say, without having that gap, because a lot of times you have a patient that has they might call from grandma's house or a neighbor's house and they have minutes on their cell phone and they don't have time to keep calling back. And that's that vicious cycle. So this has streamlined that within a short period of time, being able to get that true education and know what to do. So I would say that again, the possibilities are endless, and we're happy to hop on a discovery call and go through, even just a simple conversation on what your pain points are and maybe come up with a solution that could work for you. Our goal is never to replace healthcare staff. So that team I was talking about, they called them the taskers. We were able to reallocate and promote within that group of people and send more people into the call center, send more people to referrals, and they were able to get promotions instead of sitting in this like intermittent medium space and just reallocate their positions. So it was I think a help on multiple levels: referrals, call center, medication refills, triage calls, provider inboxes. It's a big picture. So we don't want to, like I said, replace the health center. We just want to extend their capacity, relieve the pressure, and make patients feel like they're able to reach someone within an appropriate amount of time and get the care that they deserve. So I do want to say thank you guys for joining us. I don't know if there's any other questions in the chat there that I can answer. I'm not seeing any. Let me see here. So the range of triage services, it says, is there a range that you can provide for triage services? So that can be adopted either whatever workflows you have in place, or it could be something as simple as LVNs just taking the LVN or LPN just taking the information and then collecting all the data and getting it over to a provider for next steps. Or it could be the model of like we have at East Valley. They wanted to take that off of their plate and integrate with RN so that way they can make independent clinical decisions just by following a workflow that Dr. Hatuk and I worked on together just to make sure it fit their practice needs. So that's something we can adopt in many different ways. If there's anything else in the chat.
That's it.
Here.
Yep, I think you can just wrap it up.
Okay. Well, thank you all for joining us today. Again, if you have any further questions, we'll be happy to answer them by email or schedule a call. And I hope everyone has a wonderful day. Thank you, Brittany and Haley.
Thank you all. And thank you all for joining us.